Thank you so very much for staying tuned to the fourth edition of the Economic Times Doctors Day Conclave as we look forward to a very interesting interaction on navigating the COVID-19 pandemic. We have with us Professor Rajendra Pratap Gupta, Global Healthcare Leader and Public Policy Expert, along with Ms. Gautam Gambhir, Member of the Lok Sabha, former cricketer. We are looking forward to this very interesting conversation. Over to you, Professor Rajendra Pratap Gupta.
Thank you. Good afternoon. And on this important Doctors Day event, thanking them. I think we are very honored and privileged to have Gautam Gambhir ji, Honorable Member of Parliament, who represents 2.5 million people. That's huge. That's almost like size of a country, in some parts of the world. And in your earlier avatar, you batted for India, brought laurels to the game, to the country. And during these trying times, you stood tall among other parliamentarians, being on the ground, getting smiles to people, helping them, saving lives. So it's a great honor and a privilege for us to interact and learn from you how it was. It was not an easy time for anyone in India or any part of the world. So what was the thing that came in when you saw this, and what did you do? Did you gather a team, or what did you do? Tell us something about how it came along. What did you do?
See, first of all, I haven't done anything what I was not supposed to do, not only as a politician, but as a human. See, you're a politician, you're a human first and a politician later, or X, Y, Z. And again, I have to thank all the doctors, because I've always believed in one thing, that the real heroes, this country need real heroes. And the real heroes were people in the defense forces, Army, Navy, and Air Force. And I can proudly say today that we have to include another section of society, that are the doctors and the nurses, who have worked tirelessly for us during this pandemic since last 1.5 years. So they are the real heroes. And this country have seen the dedication and everything and the sacrifices these doctors, nurses, everyone has made. So I have to really thank them from the bottom of my heart. And again, when you talk about me, again, I don't like too much talking about my own self, because for me, I think humanity was the most important thing, which all of us needs to show during these times by helping each other. Because when people talk about, there was so much of negativity around, we were listening to all the negative news and stuff. But if you see the positive side of it, yes, this was a great opportunity to serve our nation. Because every time we keep listening to this question, what this country has done for us, the time has gone. It's time where we say what we can do for this country. And this was a great opportunity, even by making the smallest of contribution, even by helping probably a fellow countryman. So again, yes, it was tough. That period was tough. But then again, when the chips are down, that is where you got to get probably your humanitarian ground going forward.
So Gautam ji, this interaction is more important given the context that we are still not out of the woods and there is always a fear of the third wave. What you did could be a lesson for other public representatives to also, do their bit, and how you went along. So are there any lessons that you learned? Are there any unique things that happened during that, or a success you would like to share that could help others, to also do to their populations and the people they represent?
See, I might get criticized if I answer this, because I'm a very strong believer in one thing. What I've realized in the last 1.5 years, or probably during this pandemic, and I hope that this thing happens, that all the taxpayers' money should go back in the development of health infrastructure, or probably other infrastructures as well. It should not be used for advertisement, irrespective of which party do I or XYZ comes from. Because this last 1.5 years has shown that our health infrastructure had collapsed. So it's time where people need to realize, all of us need to realize, I'm a politician as well, I'm a MP as well, but one thing I would definitely want to see is probably the money, the people that earn their hard-earned money should go back to their own facility, whether we include the health infrastructure in that, whether we include other infrastructures. So this is one thing which we all need to learn. And at the same time, yes, everyone has contributed. It's not only me that who's made the biggest contribution. There are a lot of other people, there are a lot of great people who've done so much for the country as well. But yes, we need to put our money in the better things, what we can, because rather than just putting those money in advertisement and all other things will not help fight this pandemic. We need to be working together. We need to work for the people. We need to work for this nation. And that's the only way we can get out of this fight from COVID.
Gautam ji, is so soothing to hear, as a former advisor to the Union Health Minister who played a role in drafting the health policy. Putting the priorities right to say that let's invest in health is very important. But, there are doctors, there are health facilities, but this situation was unprecedented. The scale of the problem any amount of health facilities that were made with the ratios, that is one bed to 100 people. But this was like unprecedented. More than that, people at the smallest thing also went to health facilities. Everyone feared, I may have COVID. In that situation, did your being a public figure earlier in the avatar of being a cricketer also help people, to get a message when you told them, don't worry, don't panic, we are here with you? Did it help them to, calm them, not rush and create load on the existing system?
Yeah, to a certain extent, I won't say that we were trying to help as many as we can. As we all know, that we can't cater to 138 crore Indians. We can't have health infrastructure for all the entire population. It's absolutely impossible. I do agree to that. But then we need to get our priorities right, which is very, very, very important. And we need to learn from this pandemic. Yes, we've tried our best to probably help as many as we can, but I can understand the kind of stress the hospitals were going through, the kind of stress the health infrastructure was going through. And that is why exactly I said that the time has come where we need to prioritize, where we need to put our money, where the taxpayers' money needs to go. And the people of this nation should question. And they have all the right, because it's their hard-earned money. They have all the right to question anyone and everyone they would want to, whether it's the government in the center, whether it's the government in the state. They have the right, because for me, I think we have, to a certain extent, have not got our priorities right. And that is where we need to learn our lessons from. And everyone needs to be accountable. Accountability is very important. And accountability only comes when you're honest. So the most important thing is that we need to be honest to our own self, and we need to be honest to the people and to this nation as well. Once you're honest to the people of this country and to your own self, then accountability will come. And from there, the responsibility will come. So it's kind of a circle. Unless and until you're not honest to your own self and to your own job, you will never be able to take that responsibility. So I hope we all learn from it. I'm not going to put a blames being on this forum that X has not done this, Y has done this, all that stuff, because I don't want to make this political. This is a forum where we all should take up responsibility, all of us. And we need to take care of the doctors, the nurses. There are so many things that has happened against the doctors as well. There were so many outrages that happened against the doctors. For example, one that happened at Apollo Hospital. Those are absolutely unacceptable. Doctors are there helping us out day and night. They're under so much of stress. We need to at least respect the human. We need to respect the other human being as well. So that is what I believe in. And I hope probably going forward, we will be asked tough questions and we should be able to answer those tough questions.
Gautamji, it is so heartening to hear the kind of statements you have made, very profound, very hard-hitting and to the point. I think a lot of people would look up to you and others to be like you when you say that, we should have accountability in the system.
I just want to add one thing. Don't be like me. Just try and tell yourself that you're a proud Indian. Because the moment you tell yourself that you're a proud Indian, everything will fall in place. Think about the country. Don't try and follow anyone, because I've never followed anyone in my life. I've always tried to keep my country ahead of any other thing. And that is what I expect every countryman to do.
Thanks. The point you say that everyone should do his duty well. And that is one message. I think that will help anyone. If all of us did that well, I think we would have changed this country forever. I think through this pandemic, what you have given as a message is a very profound message. And that should become a part of our culture of doing things. Do your job fair. So, given you were mostly in the news for being on the ground helping people, and I need to ask you this question, is that, did you feel at any time, despite your working hard 24/7, that there were moments where you felt helpless, where you thought, I could have done more had this been there? Is there a message that you would want to give to people that, yes, I probably could have done more? I felt at times that I couldn't do what I could have done probably if there was this or if there was that. Is there something for us to look at?
Many a times, those 1.5, 2 months were like a nightmare. And the kind of stories I was listening to, the kind of calls I was getting was kind of a nightmare. And there were times when I felt absolutely helpless. And during those unprecedented times, sometimes you got to take those probably different decisions as well, which might not go well with the certain section. So for example, I'm not going to elaborate because the thing is, obviously, the matter is in the court. For example, the FabiFlu thing. And I had to do it because saving lives were more important than thinking about your own reputation. Because if whatever I could do, if that could have saved even one family, that was worth it. Because the kind of cases imagine 40,000 cases coming every day. You can't keep thinking about, oh, this is what the law says. I can't go beyond this law because I'm a politician right now. Probably had I not been a politician, no one would have questioned me that. But as I when I started this interview with you, I said it is not about being a politician. It is about being a humanitarian. And on that front, I was actually literally thinking from being a human who could help anyone, everyone possible. So for me, I think sometimes you got to take decisions which might not go well with a lot of people. But then again, when you have to do something, if you can save someone, if you can help someone, if you can help the family probably revive, or probably not help someone not getting collapsed as a family unit. Imagine if there's only one earning member, and the family loses him, what happens to that family? So I've always believed that it's fine. I would face what I have to. But then again, I was very proud. Probably my foundation was very proud. The team that was working with me was very proud that we could try and help as many people as we can through our own foundation. And whatever happens in the future, absolutely happy to accept that.
I think your intentions were very clear. It's about actions to save lives. So whatever needed to be done at that point in time in the kind of panic situation was there, you did your best. You didn't.
This is what the people will answer. I think people will have their own opinions about it. See, people can politicize that, but I'm sure whoever we've helped with the right intention, for me, intentions do matter. My conscience does matter. If I can look myself into the mirror, if my conscience is very clear, I don't need to worry or fear about anything. And I don't fear about anything.
Just, I know that you are busy and time at hand is limited. So my last question, is about, we still don't know, although the cases are going down, but people say there's a Delta variant, it will be more infectious. Is there something as a institutionally you are preparing your team to be ready in case that happens? Because we know that system will take time to shape up. All said and done, even if you put money on the table, money doesn't bring beds or functional beds for that matter. Is there something that you are doing within your team to shape up, saying, if this happened, we should be better prepared than last time? There are lessons learned. Are there certain lessons learned that, people can, take up from your experience of being on the ground?
See, it's a very valid question. I think it's the people that need to take responsibility. Governments are there to support them, but ultimately you got to take your own responsibility. Wear a mask. I see so many people walking on the roads, do not wear a mask. They feel that we've already won against Corona, but that's not the case. The third wave probably might be around the corner. So it's their responsibility as well. And it's not only about themselves, it's about looking after each other as well. And that is the only way. Get yourself vaccinated. There are so many, I've heard examples where people are so reluctant in getting themselves vaccinated. Why? Just go out there, get yourself vaccinated, wear a mask. If you have to go out, then go out. Keep social distancing. It's all of us a responsibility. This is our nation. The only way we can beat this Corona is when we all will be together and probably fight this battle together. We can't just probably be divided and thinking that, okay, it's his responsibility or her responsibility. It is all of us as responsibility. And I'm sure people will learn from the second wave, and probably going into the third wave, we'll be much better prepared. And hopefully we'll be able to fight this virus and probably be able to win it.
Gautamji, you said in the beginning, we should be a proud Indian. After talking to you, I think I feel more proud. There are people like you who do us proud by the action, still are modest and humble enough to say, I didn't do anything, it was my duty. It's really a pleasure talking to you. And that what you have done will help others also to stay grounded in reality and be as bold and as candid as you were to make sure that the system becomes responsive, responsible, and accountable. Over to ET. Thank you very much.
Thank you so much.
Thank you so very much, Professor Gupta, for taking this interaction forward. And thank you so very much, Mr. Gautam Gambhir, for having joined us. You indeed are an inspiration for the younger generation. You mentioned that don't follow anybody, don't take a lead from anybody, but really be your own person. But now knowing all the good work that you and your teams have been doing, you really are a leader. And I'm sure that our younger generation has a lot to learn from you and a lot to take the lead from. So thank you once again for having joined us. Proud Indian as we are, and today is all about saluting our heroes right here, saluting our frontline warriors. The 4th edition of the Economic Times Doctors Day is really about thanking and appreciating all the good work all the sacrifices that you make day in and day out. The Economic Times Doctor's Coffee Table book will feature successful stories of inspiring doctors. It shares about the exemplary work done by doctors. There's a lot more, and very soon we're also going to be felicitating doctors who have done some fantastic work. So do stay tuned.
Thank you. Thank you so much.
Thank you very much. Thank you.